Okay, why is mast cell activation syndrome this unknown thing? I'm trying so hard to learn more about this, but my naturopathic doctor doesn't know anything about it. My rheumatologist looked at me and said, I'm not the right doctor for that. And when I went to an allergist months ago, I asked about that because I had horrible period cramps and I had stuffy nose for so long. I had really low blood pressure that day, and I obviously have this rash. And if you have an overgrowth of mast cells, that equals a histamine intolerance. And there's not, to my knowledge, there's not many ways to test for that via labs. It's kind of difficult.
Hi, I'm Dr. Martin Smith, and today we're going to talk about mast cell activation syndrome, or MCAS. And she's correct. A naturopathic doctor or a rheumatologist does not treat this condition. It is a board-certified allergist and immunologist that you need to go and see. So MCAS is a complex and often misunderstood condition where your mast cells overreact and release chemicals such as histamines, prostaglandins, and leukotrienes. These chemicals can trigger a wide range of symptoms, including hives, flushing, nausea, vomiting, diarrhea, abdominal pain, wheezing, and even fainting. Think of mast cells like your body's immune sensors. They usually protect you from things such as parasites. But in MCAS, they go haywire, something I like to call twitchy mast cells. There's three main types: primary MCAS caused by mutations in the mast cells themselves, secondary MCAS triggered by allergens and infections, and idiopathic MCAS. We are not entirely sure what is the cause. There are diagnostic criteria on how to diagnose MCAS, and one of the cornerstones is you must have severe recurrent symptoms involving at least two organ systems, such as the skin and the GI tract, or the respiratory tract and the cardiovascular system. Secondly, we need lab evidence of mast cell activation, such as a raised serum tryptase or elevated urine markers of histamine metabolites. These are not perfect tests, and you usually have to do them within a couple of hours of experiencing a flare. Thirdly, and almost most importantly, your symptoms should improve with mast cell stabilizing medications such as antihistamines or mast cell stabilizers. The diagnosis is tough though. Tests are not always accurate, especially if not handled properly or the tests are not done shortly following a flare. It also doesn't help that the majority of doctors have not learned about this condition in med school because it has only been described recently. The vast array of symptoms can also mimic a bunch of other diseases, making it even more difficult to diagnose. There are also more severe and rare mast cell disorders such as systemic mastocytosis or mast cell leukemia. The bottom line is it's better to go and see an allergist and immunologist if you think you have MCAS, and once we diagnose it, we can manage it relatively easily.